Good afternoon. Could you please state both your first and last name and spell them for the record?
Absolutely. My name is Michael Lohmeyer.
How are you employed?
I'm an emergency physician at the University of Wisconsin Hospital and Clinics.
And you're an ER physician, so you have a MD?
Yes, ma'am, that's correct.
Okay. And I assume as an ER physician, you see lots of patients.
Yes, that's correct.
And I assume you do not remember all the details of every visit.
Unfortunately, no.
Okay. So, doctor, would it assist you to have a certified medical record of the visit with the patient we're going to discuss today in order to testify?
Yes, thank you.
So on June 17th of 2021, did you in fact see a patient named Chandler Halderson?
Yes, ma'am, I did.
Before you look at the certified medical record, do you have any independent recollection of that visit?
Prior to being contacted by the subpoena, I did not have any recollection of the visit, no.
Okay. So feel free to review and to look at the certified medical record. So do you know about what time of day you saw Mr. Halderson on June 17th?
I believe it was around noon. That day I was working out at the emergency department at the UW hospital at the American Center, also known as TAC.
Did Mr. Halderson present there in the ER?
Yes, that's correct. He self-presented.
What symptoms did he present with?
I believe he was complaining of some pain to his head and his right ribs after a reported fall down some stairs.
So what did you do in your treatment?
In the emergency department, we have an attending physician who's responsible for all patients that present to the ED. We also have a team of physician assistants who we work with. At that time, my physician assistant went and evaluated the patient first. He came up with a treatment plan. We discussed it. I evaluated the patient afterwards and agreed on the plan, and then got some imaging.
What imaging did you get?
We got a CT scan, a CAT scan of his head and his C-spine, his cervical spine.
What, if anything, did that imaging reveal?
Those images were reported as being negative without abnormality.
Did you perform any other tests?
So he had a physical exam during which the PA and I both did an abbreviated physical exam looking for any signs of injury. We did discuss with the patient a potential x-ray of his ribs because he was having some right-sided chest tenderness. At that time, the patient declined the additional imaging, and I think at about that time we closed the encounter.
Did you run any other sort of tests such as blood tests or anything like that?
I would need to refer back. I don't recall.
Yeah, and I didn't mean that as a trick question in any way.
Yes, ma'am. Typically, we will get some screening blood work on patients as well. I don't have that information in the front of my mind. I'll have to review here quickly.
Well, actually, let me just ask perhaps a more precise question. When somebody comes in with and self-reports a fall, maybe has some bruising, is there any test that you can do to determine, yes, they have a concussion?
No, ma'am. Unfortunately, a concussion is a clinical diagnosis. It's usually a rule out by testing for other conditions such as skull fractures, bleeding around the brain, things of that nature. When we don't find those, there's not really a good blood test or an imaging test that definitively diagnoses a concussion.
So if I showed up in your ER today and told you I fell, my head hurts, I hit my head, would I be diagnosed with a concussion?
A head injury alone is typically not enough to get a diagnosis of concussion. Usually there are some symptoms that go along with it. Photophobia, so bright lights bother me, loud noises bother me. Looking at a computer screen or a television is difficult. Sometimes people will complain of difficulty concentrating, nausea. Generally, it is the combination of a head strike with some other clinical symptoms or complaints that will give a diagnosis of a concussion.
And those symptoms, again, are self-report symptoms.
That's correct.
They're not symptoms that you can actually look at cells or look at imaging and say, yep, you have nausea.
That's correct.
And what was after you did the imaging, what was sort of the take-home plan or continued care plan for Mr. Halderson?
So we generally have patients with mild to moderate concussions managed with Tylenol, ibuprofen, over-the-counter meds. Occasionally we'll give a prescription for an antiemetic or an anti-nausea medication so that they can drink plenty of fluids and stay well hydrated. I believe for this case, the patient had some residual neck pain, so he was given a collar to go home with for support with instruction to follow up with his primary care physician and with the spine team that was on call.
Is it unusual for you to hand out a neck brace or a neck collar with somebody who says, hey, my neck is hurting?
No, ma'am. It is not unusual at all.
Okay. And you said diagnosis of a mild or moderate concussion. What, in this case, did you diagnose Mr. Halderson with?
I believe he was diagnosed as having a mild concussion, and I believe in the notes it reported him as having just a CHI, a closed head injury, so a nonspecific diagnosis.
Did he state whether or not he had taken anything for the pain he was experiencing?
I do not recall that information off the top of my head. I would have to review the notes.
Do you mind reviewing the notes?
Sure. So I do not have that information in my addendum at the bottom. He may have reported that information to either the nurse or the PA who saw him, but I did not personally take any of that information.
Okay, thank you. And you said you had provided a neck collar. What instructions, if any, did you give him concerning that neck collar?
Yes, ma'am. So when we have someone with persistent pain but negative imaging, they go home with what's called a PMT collar. It's a soft collar that gives support to the head and the neck. I will say that many times patients have improvement of their symptoms before, so they'll self-remove their collars and they may or may not present later for follow-up.
At any point, did you give Mr. Halderson directions that he had to wear it for a certain amount of time?
I did not specifically give him that information, no.
At any point in time during your visit with Mr. Halderson, did you tell him he was going to experience paralysis?
No, ma'am.
At any point during your time with Mr. Halderson, did you tell him that he had a brain bleed?
No, ma'am.
At any point during your appointment with Mr. Halderson, did you at any point tell him that he had a brain aneurysm?
No, ma'am.
At any point, did you tell him that he had nerve damage?
I don't believe so, no, ma'am.
At any point, did you tell him he had a spinal injury?
No, I don't believe so.
At any point, did you advise him that he should not fly in an airplane?
No, ma'am.
At any point, did you tell him that he should not drive?
I don't believe so, no.
At any point, did you ever say that he shouldn't drive long distances?
No, ma'am.
At any point, did you tell him that he had a hematoma in his brain?
No, ma'am, I did not.
At any point, did you tell him that he would have an inability to use his legs in a normal manner?
No, ma'am.
At any point, did you tell him because of his mild concussion that he was going to have a colostomy bag?
No, ma'am.
And just to be clear, that's a bag for poop.
That's correct.
At any point in time, did you have to drill a hole into his head?
No, ma'am.
At any point in time, did you tell him that he was going to have surgery where a hole would be drilled in his head?
No, ma'am.
No further questions.
Cross-examination.
Thank you. Good afternoon, doctor.
Hello.
I don't have a lapel mic, so I'm just going to stay seated, if that's okay with you.
Yes, ma'am.
Now, you did diagnose Chandler Halderson with a mild concussion, right?
That's correct.
And you can diagnose someone with a concussion even though the imaging didn't show any abnormalities, correct?
That's correct.
When you diagnose someone with a concussion close in time to when the hit to the brain happens, symptoms can either improve or get worse after that moment in time, correct?
That's correct.
So when they leave the ER, sometimes people get better, sometimes people experience ongoing or more symptoms, correct?
Yes, ma'am.
And when Mr. Halderson was leaving the ER, he was given a sheet of instructions of things to watch for, correct?
I believe so, yes.
On that sheet would have been things such as blurred vision, correct?
I believe so, yes.
Increasing headaches, correct?
Yes.
Weakness in his extremities, correct?
Yes.
And you wouldn't know whether these things actually happened or not unless the patient reports back to you, correct?
That is correct.
But he would be told to be on alert for these things if they happened, correct?
Yes, ma'am.
And to generally rest and avoid stimulation in order to improve his concussion symptoms, correct?
That is correct.
Things like avoid bright lights, correct?
Yes, ma'am.
Screens,
Yes.
video games, things like that, correct?
That's correct.
One of the treatments for a concussion is just to sit in a darkened room and really not do anything with your brain, correct?
Rest is generally one of the recommendations, yes.
Now, as a result of his visit, you did prescribe him some medication, correct?
That is correct.
For nausea?
Yes.
And what was that?
It's a medication called ondansetron. It's also known as Zofran. It's an anti-nausea medication.
He had reported feeling like he was going to throw up, correct?
I believe so, yes.
And that's why you would prescribe him that medication.
Yes, ma'am. It's also to help prevent dehydration. So sometimes people will get dehydrated, their headache will get worse. And so we like them to stay hydrated. So sometimes it's a preventative measure as well.
And just to be clear, when someone reports that they have a headache, as Ms. Raymond asked you, there's no test, blood test or something like that, that can confirm what the person is telling you, right?
I don't believe so, no.
Now, when he presented in the ER that day, wanted to ask you what this means. Patient remains with midline cervical spine tenderness palpation. What do those words mean?
So as part of the physical exam, when we are examining a patient, we will actually press on the spinous process over the middle of their neck. He had tenderness on presentation, which was a big part of the reason why we got the CT scan to begin with. And on reassessment after the negative imaging, we reassessed the patient. He still had persistent pain in the midline there, which is not a direct indicator of an injury, but it does say we should keep the collar on for safety.
And when he left with the collar that day, you testified that there was no set time he was supposed to wear the collar, or you didn't give him a set number of days to wear the collar. Is that right?
I don't believe so, no. The instructions were to follow up with his primary care physician and with our spine doctor.
And that was in 4 to 6 weeks?
Generally, that's the time frame that they recommend. I can't recall specifically for this case, but I generally encourage patients to call if they're continuing to have any symptoms after they go home.
That's it. Thank you.
Redirect.
Doctor, with self-report symptoms such as nausea or headache, is the information you receive from the patient only as good as the accuracy or honesty of that information?
I'm not sure that I totally follow the question.
If a patient lies to you and says, my arm hurts or my head hurts, is that information useful to you if it is in fact a lie?
I tend to take my patients at their word. I think that if I get into trying to second guess them, it gets to be, my job gets too complicated. So when patients present symptoms, I generally take them, unless I have something to prove or disprove, I take them at their word.
As far as scientifically or medically accurate, is it only valuable in as much as it is true?
Yes, I assume that it's true and that's how it's medically relevant.
Okay, thank you.
Thank you.
May the doctor be excused and released?
Yes.
Thank you so much for your time, sir.
Thank you.
You're excused from your subpoena and released from the same.